Is this our own version of maybe, say, a disease control agency, or do we need to have one?
We have a center. We have Center for Disease Control, Nigerian Center for Disease Control, in Federal Ministry of Health, and they
are they as robust as we expect them to be, or do we need to look at that again?
Well, they are trying their best.
Yeah. Okay. What about Lagos? What are we doing?
Well, in Lagos here, we have done quite a number of things. One, this is part of what you are also joining us in public health education and enlightenment, enlightening the public about it. We have produced public service announcements, almost more than a week now, which has been relayed in some of the TV and radio stations. And apart from that, we have also communicated written letters to our secondary health facilities, primary and tertiary health facilities on this particular disease, the fact sheets to use, the measures that the healthcare workers should take, and also collaborating with the port health services. Have direct link with the director of port health services so that in case they have any suspected case, should let us know. And we have designated an hospital, one of the secondary health facility, mainland hospital at Yaba, that is owned by Lagos State for isolation of any suspected case and then further management.
What can we do on our own? Because away from quarantine, which we can actually do in case of any suspected case, for those, perhaps, are there ways we can actually imbibe some kind of cultural practices to mitigate the effect of infection?
Well, there are. Well, one is this public health education, for people to be enlightened, to know what it is and what to do. Secondly, we go through the normal, hygienic practices of regular hand washing. When you touch a particular surface, when you go to the hospital to visit someone who is sick, whether you touch or not, you need to wash your hand thoroughly. And these animals, again, some people are fond of playing with animals and we are not saying the virus is with any animal, but the hygienic practices we should try to always adopt. And then also people that have contacts, avoid having contact, because we can have some of our people here that will travel or that are already here that are watching us now. If they are in those areas where this infection is going on, they should avoid contact with those animals that have been incriminated to carry this particular virus.
Do you, okay, well, a good thing you didn't mention.
And then another thing is, the dead body too of those people who, had the disease can also get the virus through.
So the virus also lives on
of course. On the dead body, you touch the dead body, because what we're talking about is anything that comes out of that dead body, any secretion, any body fluids is infected. Even for a man that is infected with that particular disease, and even after getting cured, 7 weeks after, he still passes this virus in his semen.
Wow.
So if he has intercourse with the wife within that particular period, can actually infect the wife.
Oh dear. Okay.
So it's as serious as that.
You didn't mention cow, chicken, turkey, so it means those ones are out of the way. So safe.
Well, I didn't mention them, but if we have contact with them, either you kill the chicken, and you try with the blood and everything, you have to wash your hand thoroughly, which is normal personal hygiene practices with soap and water.
What about fruits?
Fruits. You wash fruit before you take the fruits. Is that not true?
Because I'm asking the Chamberlain because now I'm thinking that most of the fruits being sold on the streets are actually fruits from other African countries, especially apples, and you get to see people get a bite maybe in traffic without even washing same. So you say people must be careful, they must wash before eating.
It's better to wash.
And wash your hands.
Even the normal, the regular hygienic practices we need to adopt.
So the simple habit of just washing your hands with soap and water as frequently as possible, washing whatever it is that you eat before you eat it if it's raw, can actually help.
Yeah, it can help. Even with the health workers.
But you have to touch before you wash it. The fruits, you have to take it to wash.
You touch, you wash, and then you wash your hand as well.
Okay, because are we also in contact with those other West African countries to monitor how they're progressing? Even Ghana is very important.
Yes, I was in contact with Ghana because I think on Saturday or so we had the news that a suspected case of Ebola was found in Ashanti region in Ghana. So I spoke with a colleague in Noguchi Memorial Medical Research in University of Ghana yesterday morning, and he told me that it's not is negative for Ebola. The test was negative for Ebola and other typical viral hemorrhagic fever that we know that is not Ebola virus.
So are they saying that there is no strain?
No, at least as of yesterday morning with my discussion, I had a phone discussion with a colleague there, so it's not.
Interesting. But
Because go ahead.
Okay, I was just also wondering now, we need to consistently keep in touch with some of this because just as we said here, what was reported is dengue fever, not the Ebola, just as in some of those cases. This has to be a frequent communication between those countries and us.
Frequent communication, and then you have to go online too to monitor the news, the updates of what is going on in Guinea, Liberia, and other countries where this infection has spread to.
So, should we, in spite of all that we're doing from the federal government and the state government, what about the capability of our health facilities? Can we handle it? Should we see one?
Well, in terms of the capability of our health facility, the capability, we have people who are capable in most of our health facilities. What we should be talking about is maybe if you need extra infrastructure or equipment that will assist in the management of those cases. And you see, for these cases, we have specialized personal protective equipment that is used for this particular kind of disease. And I know that the Federal Ministry of Health to have that. We in Lagos State, frantic effort. For the end of this week's weekends, we should have the stock with us and pre-position it in some of the health facilities.
Do we have any need to panic or worry?
Well, I don't think we should panic, because if we panic, we'll not be able to take the appropriate measure. What we should do is to make sure that strategically we continue this public health education and enlightenment and let the health workers have high index of suspicion. We go on with regular personal hygiene and environmental hygienic practices. You have to be clean. Environment should be clean. We ourselves should be clean. Regular hand washing with the soap and water, and then monitor what is going on and see how we can intervene. And then probably too at the different ports of entries, the airport, the seaports, and then the ground crossing at the borders. We should, intensify our effort on active surveillance.
Just like dengue fever, can this also be transmitted through mosquito bites?
No. It's not transmitted through mosquito bites.
That's a relief.
It's primates. Primates. We've talked about the fruit bats. We talk about monkeys. We talk about chimpanzees and gorillas.
What about dogs?
Not documented. But there are some other animals. Maybe it has been also documented that in areas where the rear pigs, these pigs can be, infected. The bats at times move around and can move to those colonies, but here we are also trying to intensify efforts to make sure that we don't have that.
That means that some of those who also have all those who rear those kind of animals that are in question here should, as a matter of fact, maybe let the authorities know, look, I do this, so you can send your health agencies or professionals just come and check just in case.
Yeah.
That kind of thing should happen.
Yeah, actually, we are also, we need to collaborate with the Ministry of Agriculture in Lagos State, who send letters to them, because it's a zoonotic infection. That is, it's an infection that is primarily infection of animals and now transmissible to man. So that's why we need to work together in order to get this prevented.
What about those who like bushmeat? Do they need to be afraid?
Well, they should not be afraid, because the bushmeat you have to cook. If you cook very well, the normal way you're supposed to cook, and it's properly cooked, the virus, the organism will die. That is even if it's infected with this Ebola virus.
The operational word is properly cooked.
Properly.
How do
we cook? We are Africans, and most of the things we eat, we cook them very. We are not Europeans, whites, who some of them smoke most of the time what they eat, and they don't even cook properly. Some are eating half raw or something like that. So, but here, the normal way is we cook our fish, our meat, we cook it properly. I think that should be able to prevent the infection. But the only thing is that when those are, hunting, this bushmeat comes into contact with, at least for now, they should, if they have not been, adopt the method of, proper hygienic practices like the simple hand washing with soap and water after touching the animals. And also the, those things that comes out of the animal, like the blood, like any secretion, is very, very important, because those are also can also carry the virus.
I'm looking at the time frame before we can see some visible effect of this particular symptom in some people. Can we then say, for those coming from countries where cases have been reported, we can easily quarantine them and check before they can actually get into town?
I don't think so.
That
is not we know the World Health Organization. We have, for example, they have not even imposed any travel restriction to those countries. And people coming from that area, mind you, in Guinea is localized to a particular region and towns. It's not the whole of Guinea. And it's it might be unlikely for the person might not have any contact with anyone that is infected, and the only thing that we should look out for here is that if that person develop any form of fever and is coming from that area, whether he has had contact with somebody that is infected or not, high index of suspicion, we should immediately try to investigate.
That's where immigration comes in here. They need to identify those countries that has been reported, and then if anyone is coming from those countries, maybe Nigerian.
Immigration, Prt2 services. Prt2 is in the purview of the Prt2 services, because they are also within the airport. And
would it make any sense if Nigeria were to maybe suggest sending some health professionals from the ministry to those countries to help them out, to prevent it maybe from spreading to other West African countries?
It's not necessary for Nigeria to send health workers there. They also have health workers in their own country. The only thing we can do is to have communication and then get updates on what is going on there, so that we'll know how we can also prevent it in our own environment.
How fast does this spread from one person to the other, or from an animal to the other if you contact it? How viral? What's the
well, the incubation period for that particular infection is 2 to 21 days, and mostly maybe 5 to 12 days you can get. But the incubation period, meaning that the period between the time that the person is infected and the time he starts manifesting signs and symptoms of that particular disease, is 2 to 21 days. So it can be as early as 2 days, and can be as late as 21 days.
Depending on your immune system?
Well, immune system, virulence, the dose of the virus that you have in with you, there are factors that can affect, how, the manifestation and go.
What about health workers' safety? This also should be primary on your list, because when we talk about those who attend to some individuals without even knowing that these are infected persons, how best can they safeguard their own health from contracting this particular disease, virus?
Well, under normal circumstances, when doctors or nurses or other health workers attend to patients, we have what we call universal safety precaution that we take, even without Ebola virus. And that is, at least when you attend to patients, when you carry out procedures, you use your gloves, and use your glove. At times, if there are cases that might have splash of blood and go, you use your face mask and all these things. So that's universal safety precaution. Even when you want to take blood for investigation, you use your glove. You don't use your bare hands. Now, so under this particular situation, to advise the health workers to continue with the universal safety precaution, and then the provision of the specialized personal protective equipment, especially in secondary and tertiary health facilities where these patients are likely to be referred to when there is index of suspicion. But the most important thing for health worker here, high index of suspicion is very, very important, especially during this particular period.
Well, let's get this one before I wrap up. Can I ask you whether we're also working with the NAQS, also stationed at the airports?
NAQS. NAQS, well, I don't know what
quarantine service.
Quarantine services. It's under the purview of the ported services, and we're working together.
All right, and Dr. Ismail Abdus-Salam is the State Epidemiologist with the Lagos State Ministry of Health. Thank you for coming on this morning.
Thank you very much.
Okay,
nice
let's remember to keep all those warnings in place and stay away from no document of dogs, chicken, cows. So except for the other ones.
No document, but we have to, take necessary precautions.
Okay, so they should be careful how they play with the gorillas and the rest. Okay, we're back after this break. Join us again.